My name is Ainsley Curtis. Today I will be talking about the importance of nurse practitioners' leadership role in healthcare. Nurse practitioners are invaluable leaders in the healthcare field with a unique patient-centered approach. They prioritize health education and disease prevention. In addition, nurse practitioners have a variety of roles. Some of these roles include mentoring, educating, and advocating for their patients. Nurse practitioners emphasize the well-being of the whole person. Thus, nurse practitioners are credible providers who are striving to lower healthcare costs and positively impact patient satisfaction, according to the American Association of Nurse Practitioners. Nurse practitioners are working to improve their patients' quality of life and to support their patients' independence. They want their patients to feel confident and to know more about their conditions. Nurse practitioners are taking on increased leadership roles with rural populations. They are also taking on leadership roles with the shortage of physicians, according to Kimberly. Rural populations struggle with access to care and a lack of resources. Thus, nurse practitioners are helping to address these concerns and improve patients' access to care. Nurse practitioners practice with an emphasis on the whole patient, considering not only their physical health but also their emotional and social well-being. Nurse practitioners can help with health education as well as advocating for their patients' needs. In addition, nurse practitioners are helping to fill in the gaps in healthcare and increase their patients' access to medical care. Nurse practitioners are vital members of the healthcare team. They place nurse practitioners in positions where they can make the most impact. Specifically, healthcare managers can incorporate nurse practitioners into roles that will benefit both underserved and vulnerable communities. Healthcare managers should empower nurse practitioners to reach their full potential. They can do this by giving them opportunities to advocate for the profession and for their patients. When nurse practitioners are advocating, they are helping their patients and other healthcare providers to understand their unique role in healthcare. In addition, managers should continue to support and provide resources for the interdisciplinary team. Specifically, managers should ensure that nurse practitioners feel confident and valued as members of the healthcare team. Nurse practitioners should be treated with respect as competent healthcare providers. This means that the managers are listening to the concerns of nurse practitioners and making sure that their voice is being heard. Also, managers should take note of any signs of potential burnout among nurse practitioners. This could include overworking and considering their stress levels. As a healthcare manager, they should encourage interdisciplinary collaboration and ensure that nurse practitioners' voices are being heard in the workplace. Administration should make an effort to reduce burnout among nurse practitioners and recognize their unique contributions to the diverse healthcare team. Healthcare workers can learn from the nurse practitioner's expertise and patient-centered approach. One example from my life is when my grandfather saw a nurse practitioner. The nurse practitioner noticed artery blockage that my grandfather was at and increased risk for a widowmaker heart attack. The qualities of the nurse practitioner that he saw exemplified the level of care for the patient. This nurse practitioner also emphasized preventing future heart complications for my grandfather. This nurse practitioner showed an attention to detail. This led to the nurse practitioner advocating for my grandfather's health. This nurse practitioner wanted my grandfather to have open heart surgery, and this surgery ultimately saved his life. As an advocate, the nurse practitioner is ensuring that the patient is receiving the care that they need. They make a positive impact on their patients' lives by educating them about their health. Nurse practitioners are mentors, educators, researchers, and administrators, according to the American Association of Nurse Practitioners. The healthcare team should be aware of the strengths of nurse practitioners and their credibility as advanced practice providers. Thus, the healthcare team should support nurse practitioners and strive to recognize their contributions to the team. As a leader, nurse practitioners should set a positive example for the team and adhere to the code of ethics. Advanced practice nurses have a responsibility to establish a provider-patient relationship where they maintain both confidentiality and trust. Patients should feel comfortable sharing their medical needs without fear of their personal health information being shared. In addition, nurse practitioners are equipped to help their patients prevent future health problems. Specifically, a nurse practitioner helps address the diverse needs of the community and increase health literacy, according to the American Association of Nurse Practitioners. In addition, they can advocate for specific needs and help families to achieve better health outcomes. For example, a pediatric nurse practitioner has the unique opportunity to address the patient's lifestyle and work to educate families. For example, the nurse practitioner can educate parents about their child's development and maintaining a healthy lifestyle. If a patient has a family history of obesity, the nurse practitioner can provide the child with resources and help them to understand the importance of maintaining a healthy diet and exercising. Specifically, nurse practitioners treat the whole person and strive to promote patient well-being. According to the American Association of Nurse Practitioners, they focus on health promotion, disease prevention, health education, and counseling. Nurse practitioners are fulfilling several roles in healthcare and playing a vital role Nurse practitioners are equipped to be effective leaders in the healthcare field. Specifically, nurse practitioners receive adequate training and are focused on providing patient-centered care. This model emphasizes the bond between patients and their healthcare providers, according to ChenMed. There is a need for qualified medical professionals to address the growing needs of an aging population. The shortage of physicians is a contributing factor. As a result of the movement towards value-based care models, more nurse practitioners are taking on leadership roles, according to ChenMed. The focus on collaborating with others, putting the needs of their patients first, and emphasizing patient relationships are strengths that the nurse practitioners bring to the healthcare team. As a provider, they are working to improve the overall well-being of their patients. In addition, healthcare facilities that promote nurse practitioner leadership have improved patient satisfaction, better continuity of care, and reduced hospital admissions, according to ChenMed. In addition, the character traits of many nurse practitioners help them to excel as leaders in the field. Nurse practitioners are known for prioritizing effective communication and preventative health measures, according to ChenMed. According to the article titled Nurse Practitioners as Leaders and Innovators, Building on the Legacy of Dr. Loretta Ford, for the nurse practitioner, leadership is defined by influence, vision, and action, according to O'Grady. Nurse practitioners use their expertise and patient-centered approach to design, refine, and implement new models of care that prioritize patient well-being, efficiency, and system sustainability, according to O'Grady. When treating a patient, nurse practitioners often use the community resources and work with an interdisciplinary team. As a result, they are collaborating with the team and working to adapt to healthcare strategies based on real-time patient responses, according to O'Grady. Nurse practitioners are also working with coworkers to help them reach their full potential and recognize their contributions to the team. They're working to encourage their coworkers and build relationships where mutual trust is established. Another strength of nurse practitioners is working to ensure that the voices of nurses, patients, and communities are heard, according to O'Grady. Nurse practitioners are effective in patient satisfaction, chronic disease management, and cost effectiveness, according to O'Grady. Overall, they're concerned with their patients' long-term health and preventing future problems through prioritizing health education and preventing disease. Nurse practitioners are uniquely equipped to address the needs of their patients. According to the article, Time and Nurse Practitioner Practice, Naming, Claiming, and Explaining the Role of Nurse Practitioners, a critical aspect of patient care is actively listening to the patient's needs based on the nursing model. Nurse practitioners work to advocate for the profession and their patients. They work to establish a relationship with the patient where there is mutual trust and respect. Nurse practitioners are working to create lasting positive changes both in their community and in the lives of their patients. Instead of just looking at the patient's physical symptoms, nurse practitioners are looking at other aspects such as the person's stress level and factors that might have contributed to the problems, such as overworking. Nurse practitioners are working to make sure their patients understand how to manage their disease as well. Additionally, according to the article titled Bridging the Gap to Healthcare Access, the Role of the Nurse Practitioner by Kimberly, one quality that nurse practitioners excel in is making sure that patients are receiving quality health care. Nurse practitioners are uniquely qualified to meet the needs of families in the community. They are addressing healthcare needs in rural populations and seeking to provide a solution to the primary care shortage. When there's a shortage of primary care physicians, it often means patients will have to wait longer to see a doctor. And this could be detrimental to a person that has a chronic illness. Nurse practitioners are helping to ease the strain of an already overburdened healthcare system by providing quality primary care through assessment, diagnosis, and treatment of complex health conditions, according to Kimberly. They are helping patients to understand their health and how to manage chronic conditions. Specifically, nurse practitioners are working to educate their patients on how to take their medications, when to take their medications, and what to expect with the medications, according to Kimberly. Nurse practitioners are taking their time talking to their patients and making sure the patients understand how to properly care for their body and to prioritize their health. Advocating for their patients means that nurse practitioners are seeking to promote their patients' overall well-being and to enhance public health. In addition, a population where nurse practitioners are uniquely equipped to serve is children with medical complexities. According to the article titled The Case for the Use of Nurse Practitioners in the Care of Children with Medical Complexities, nurse practitioners are helping to provide cost-efficient care for these children. According to this article, there is a lack of training and knowledge regarding complex children, high patient volumes that result in decreased available time to spend with individual patients, limited resources, and inadequate staffing, according to Samuels. Nurse practitioners are working to solve these problems and provide care that is effective. They are working to help address these needs in the community and provide quality care for children with medical complexities. Nurse practitioners are uniquely equipped to ensure timely communication, and address the child's overall needs. This means they are looking at the child's developmental, educational, dental, social, and financial concerns, according to Samuels. Nurse practitioners are working closely with families to address the child's healthcare needs. In conclusion, nurse practitioners are leaders in the healthcare field who are making a positive difference in their communities. Nurse practitioners are working to improve patient care outcomes by providing cost-efficient care and improving their patients' access to care. Through the patient-centered model, nurse practitioners are impacting the lives of their patients on a daily basis. Specifically, nurse practitioners' attention to detail and relationship focus are helping patients to make long-term changes to their lifestyles. In addition, nurse practitioners are striving to prioritize health education and disease prevention. Through the guidance of nurse practitioners, patients are empowered to make decisions that will positively impact their future and their overall health. In addition, nurse practitioners are impacting rural areas with their expertise. They are part of the solution to the provider shortage and are working to meet the needs of children with complex medical conditions. Nurse practitioners are advocating for their patients. They are active in their communities, advocating in health policy. They are working to prevent diseases and looking at the patient's family history to help them better be equipped to know how to handle their medical needs. Nurse practitioners are collaborative and effective communicators who are improving the health of their patients. Nurse practitioners are empathetic listeners according to the American Association of Nurse Practitioners. As a result, patients are more willing to express their needs and be open about their health concerns. In addition, nurse practitioners are quality healthcare leaders with a holistic approach. Thank you so much for listening to my presentation. These are my references.